Hello! In today's video, I will show you how cervical spine MRI detects whiplash-associated disorder and ligament sprain.
Picture this. You're stopped at a red light, minding your own business, when suddenly, bam, you get rear-ended. Your head snaps forward and back. You have severe neck pain, stiffness, and a pounding headache. You rush to the emergency room, they take some pictures, and the doctor walks in and says, "Good news, the X-ray is normal." But you don't feel normal, you're in pain. This is the classic scenario for a whiplash injury. And here is the problem. Normal on an X-ray just means you didn't break a bone. It tells us nothing about the soft tissues, the muscles, the ligaments, and the discs that actually took the brunt of that impact. This is where the MRI comes in. While an X-ray looks at the frame of the house, MRI looks at the plumbing and the wiring. It can turn an invisible injury that people might doubt into a visible, objective medical diagnosis. So today, I'm going to show you exactly what we look for on a cervical spine MRI after a car accident and how it explains that pain in your neck. The term whiplash actually describes the mechanism of the injury, that rapid back and forth whip motion, but the MRI shows us the result. One of the key strengths of MRI is detecting ligament sprains or tears. Ligaments are the tough bands of tissue that stabilize your spine. In a violent accident, these get stretched or even torn. When we look at specific MRI sequences that are sensitive to fluid, we are looking for a high signal. In simple terms, we are looking for bright white spots. That bright white represents edema or inflammation inside the ligament. This is objective, undeniable evidence that the supporting structures of your neck have been damaged. Next, we have to talk about the muscles. The powerful muscles of your neck and upper back often act as the brakes during that whiplash motion, meaning they take a huge hit. On an MRI, we can actually see edema or fluid right inside the muscle belly itself. This indicates a significant strain or even micro tears in the muscle fibers. And this is crucial because it validates your symptoms. That severe stiffness, those muscle spasms, it's not just tightness, it's physical trauma to the muscle tissue. And here's why this matters for your head. While you might not have a pinched nerve from a bone, the massive inflammation from these muscle injuries can irritate the nearby nerve roots. This is often the cause of cervicogenic headaches, headaches that aren't starting in your brain, but are originating from the injured structures right here in your neck. Finally, an MRI can reveal something subtle that an X-ray will miss 100% of the time. Traumatic disc injuries. The force of whiplash can cause a small tear in the outer wall of the disc. We call this an annular tear. It might also create a small disc protrusion that wasn't there before. Now, these might not be massive enough to look like a surgical emergency, but don't be fooled. An inflamed annular tear is a potent source of chronic, deep-seated neck pain. It's essentially a chemical leak inside your spine, causing constant irritation. So, if you are suffering from persistent symptoms after a whiplash injury and your X-rays were normal, don't lose hope. A cervical MRI can provide that deeper look we need to identify exactly which tissues were injured. Understanding whether it's a ligament, a muscle, or a disc changes how we treat it. It guides more effective physical therapy and helps us manage your pain better, because you can't treat what you can't see. If you have a scan but feel like you're missing that clarity, we can help. At our clinic, we provide a professional, remote second opinion service. You can securely upload your scans from anywhere in the world, and our neurosurgeon will provide a detailed, easy-to-understand report, giving you the confidence to make the best decision for your health. The link is in the description below. If this video helped you understand your condition, hit that like button and share it with someone who needs to see this. And if you need clarity on your own scan, remember to check out the Second Opinion service. Thank you for watching.